Hi, good morning, everybody, and welcome to today's edition of Policymakers Live. My name is Susan Martin, Director of Government Affairs here at MassBio. For those of you who haven't joined in the past, this is a one-on-one discussion with Bob Coughlin and our special guest, followed by Q&A from the audience. So please, if you have any questions, type those in the Q&A box below, and we'll get to as many questions as possible. Thanks again, and I'll turn it over to Bob.
Thank you very much, Susan, and welcome, folks. Welcome to all of you to the first edition of Policymakers Live for the month of July. You know, we've learned to adapt to this new way of interacting with elected officials through this new series of virtual briefings, and we've been able to have so many in-depth conversations with legislators on a number of topics that are important to the life sciences and so many of our member companies. I want to start off by offering an immense thank you to the sponsors of this third series of Policymakers Live events during the month of July: AbbVie, Sanofi Genzyme, and Takeda. Again, a big thank you to AbbVie, Sanofi Genzyme, and Takeda. And I want to thank all of these companies for helping MassBio continue to advance our mission of making Massachusetts the best place in the world for the life sciences. And I'm so excited today to have our guest on our first edition of the month of July Policymakers Live. We have Senator Cindy Friedman. And, you know, I want to welcome Senator Friedman to this week's edition. She represents the 4th Middlesex District, which includes the towns of Arlington, Billerica, Burlington, Lexington, and Woburn. And she was elected to the Massachusetts State Senate in July of 2017, filling the seat that was vacated with the unfortunate passing of the amazing, wonderful late Senator Ken Donnelly, for whom she was the chief of staff, and we all do miss the senator. He was a wonderful, wonderful person. Prior to working in the State House, Senator Friedman was a public school teacher as well as an executive in the high-tech industry. She's currently the Senate chair of the Joint Committee on Healthcare Financing, who we have the pleasure of working with extremely closely since she's taking over that chair position. And she also serves as the vice chair of the Senate Committee on Ways and Means. You know, we're all looking, Senator, forward to hearing your thoughts on how legislating has changed, the Senate's plans for the rest of the session, and what initiatives you're considering as you grapple with the impact that COVID-19 has had on the Commonwealth. And before I jump into specific questions, Senator, how are you doing? You've had a long week, and we can't thank you enough for being here. And I promised you earlier, this will be a fun 30 minutes, because anyone who serves an elective office right now deserves to have a little bit of fun. How you doing?
I'm doing well, thank you. I appreciate your appreciation of what this or actually the last week, but I'm good, and I'm glad to be here, and I really thank you for having me.
Well, thank you, Senator. Why don't we start off talking about revenues? COVID-19, as we all know, has had a tremendous impact on state revenues. The Commonwealth faces a budget deficit between anywhere from $5 and $8 billion, right? This is unprecedented. It's unfortunate. It means that revenues will be about 17% less than what Governor Baker predicted in January. And with all these unknowns around state collections and the amount of federal aid coming in with the Commonwealth, especially in your role as vice chair of Ways and Means, how do you see the budget process playing out for the remainder of the session?
I think that because of all of the unknowns, I think what we're going to see is probably a 1/12 or 1/6 budget that comes out, because we are at the end we're in the middle of July, so clearly we're not going to have a standard budget process. I think the unknowns are so great right now, especially around the areas of federal support, that I think what you'll see is there'll be a small budget, and then we'll be coming back as things settle down or as things become clearer in terms of the financial outlook. Then we'll start to do a longer term budget. I think that's the reasonable thing to do at this point, because we don't know, and because if we just start now, the cuts would be so severe that I think we would be creating a situation that nobody, not only would nobody be happy, but we would be doing some very the severity of the cuts would be so much that I think we'd be hurting things that we really have no intention of hurting. So I think we need to take a very, we're going to be taking a few small steps to keep us going, and then we'll be, as things become clearer, we'll do a longer term budget.
Yeah, absolutely. Absolutely. And to the folks in the audience, feel free to use the Q&A function. I've got a list of questions here that we're going to go through. But as always, we want this to be just like a meeting, as if we were in at the State House having a roundtable discussion. So if any of you folks have any questions, throw them out there. I'll moderate them. If it's a question I don't like, I'm just going to ignore it. But last month.
You ignore it too?
Yeah. Senator, last month, the Senate held a healthcare listening session to hear from the administration, stakeholders, policy experts, impacted populations, and others to analyze the state of the healthcare as the healthcare system, the Commonwealth reopens and recovers from COVID-19 pandemic. And thank you so much for doing that. I think the communication between all the different components in our healthcare industry and government truly has been a model for the rest of the country. So can you give us any insight on what you learned from that exercise and some takeaways from it?
I think a couple of things, important things came out, some that we didn't know and some that we did know but were reinforced. One of the things that I think was very valuable that came out is the sort of state of our public health system. And that while we've known there have been areas of weakness in it, it has really been affected by the pandemic, and those cracks, if you will, have been exacerbated. So really learning and understanding that our public health system has to be a lot more integrated. We need a lot more focus at the local level to support public health initiatives. And I think we heard a lot of that on the call. And, to be really frank, we have not paid a lot of attention to public health over the past 20 years or so. They've taken enormous hits. They've lost a lot of brain power in people that have had experience. And now when we have this pandemic, we're seeing the effects of that. So I think that's something that has become very clear. On the other side, we have seen that some things that have happened, that have been caused to happen because of the pandemic, have been incredibly successful. So telehealth, scope of practice, limiting some of the out-of-network billing issues that we've all been facing, those have been an enormous boost to the healthcare system and to people accessing healthcare. So that's been really interesting. And what we just hear over and over and over again is telehealth, telehealth, telehealth. And I think the other piece that's been really good for us to see is there's been a significant reduction in an administrative burden that a lot of our providers have to go through in order to deliver care. And some of that has been relaxed, and it has made a real difference in the delivery of care. So those are things that we learned. Those were things that have been really reinforced because of this pandemic. And so, so I think that's been really valuable. We really kid ourselves. We spend a lot of time laughing because there are many of us who've been working on telehealth. I mean, I've been doing it for about 12 years. There's been people for 20 years, and we did it in 15 minutes.
Yeah. I mean, it's interesting. I mean, and isn't it, it's crazy and interesting. Like sometimes it takes a global pandemic to make us react in a way. And telehealth, I mean, you guys passed the putting patients first act, right? And that may not have happened. And it may not have happened as quick as it did. And telehealth is a perfect example. And let's think about, maybe we can riff off of that a little bit as it relates to mental health, right? That's something that you're such a huge proponent of. I mean, how do we tie telehealth into ensuring that we provide more services for folks in the mental health area?
Right. Well, it's really been fascinating because I've been talking to a lot of the providers. And if you look at the data, just in people coming to their appointments, was about a 40% no-show in providing behavioral health care. So that's showing up for their appointments. And you can understand all of the different reasons why that would be happening. The no-show rate is now less than 5%.
Wow.
That's how many more people are in certain, facilities. That's how many more people are getting care. And
Yeah.
that is just profound. And that's
Yeah. It's amazing. And when you think of, as we look at disparities in healthcare as well, right? And there's a whole new thing we need to think about, and to make sure that people have access to broadband, they have access to the computers, the access to the ability, because we want to make sure that this is a way that it truly is easier to meet with your physicians and get the care that they need, because it saves money. Even thinking about having a child with cystic fibrosis, you would think that telehealth wouldn't be an option. My son with CF has had 3 telehealth appointments, and prior to COVID-19, he had 0. And it's a great way to check in with your physician and think of how that saves money for the healthcare system, yet think of what it does for the consumer. You don't have to pay for parking. You don't have to pay for transportation. You don't have to take a whole day off from work, right? If parents are working. So I just think, and again, Senator, you and I have worked together in our capacities here for a couple of years now, and maybe I'm an eternal optimist, but I think COVID-19 is going to force us to do a lot of things better. And if we can continue to identify where those areas are and continue to make improvements like you folks are working on in telehealth, I think that's an amazing thing. Back to patients a little bit as well. The current Massachusetts law allowing for copay assistance is set to sunset on January 1st, 2021. Last week, the Health Policy Commission, and again, I'm leaving this Zoom call to get on another call directly with the HPC advisory group, released their study on co-payment programs, noted that, quote, eliminating the availability of coupons at this time would likely have serious challenges for many patients in the Commonwealth. Understanding that we don't want to do anything that reduces the amount of generic utilization. We support a healthy generic industry. Copayment assistance is a big deal for patients that are using breakthrough therapies. What are some of your thoughts on the additional extension of the sunset this session, similar to those that have been approved in years past?
So I thought the report was pretty interesting. It certainly pointed out that we don't use a lot of prescriptions in Massachusetts. They also showed that it was not, given how much we use it, it wasn't a huge impact on the overall system cost for premiums and system. It did show that there was a certain amount of abandonment of the usage of the drugs once the copays ran out. That's a concern. So I think we're looking at it, and we're continuing to look at it. Our focus is to get people access to care. My number one focus is to get people access to care and to get them the care that they need. And then what is, how do we mitigate the cost of that? Because we don't, we do need to worry about costs. So we're going to be looking at that really carefully and looking at, I think there's more questions that you're going to be talking to them. We're formulating some more questions around that. I just think at this point we're learning and we're digesting what they put out, but it was a very valuable report for us. And, we just want to make sure we continue to balance the cost of the usage of that coupons and how it's affecting the overall system and how it's affecting the continuation of those medications for people who need them. So we'll be looking at it. I'm glad it came out now. I did get a chance to read it. I didn't get a chance to digest it yet, but listen, there's a lot of opinion on both sides, right?
Yeah.
There's valuable opinion, not just, people screaming in the wind, but there's good arguments on both sides. So how do we use the best of both is what we'll be looking at.
Well, we look forward to working with you and Chair Rodericks on a way to try to protect patients as it relates to that, and your colleagues on the House side, and we'll be doing that over the next few weeks, right? I'm going to go off to a question from the audience, then I'll come back to some of the questions I was focused on. And this is a great question that's coming in from George at Sanofi. Many scientists and companies of our industry are working around the clock to develop, test COVID-19 vaccines. As you know, 85 companies in Massachusetts are focused on COVID-19 research, whether it's in diagnostics, therapeutics, or vaccines, okay? And hopefully, soon, there will be vaccines that are approved and being manufactured. The only way we're going to get out of this problem is with science, and it's amazing to think that we have that greater critical mass than anywhere else in the world working on this. So at the point that the vaccine is approved, and there's been a lot of discussion happening with several of your colleagues, Senator, and several discussions on the House end, especially with the administration and my close working relationship with Secretary Sutters. We talk a lot about this. When the vaccine is approved, what are your thoughts on how government and industry could continue to collaborate to ensure that the appropriate distribution happens to all people? And again, we're not trying to spot you on a question like this, but we've been saying, if people thought it was tough to get an N95 mask, think how tough it's going to be to get a vaccine once the vaccine's approved. We're talking about, tens of millions of doses, right, that are going to have to get out around the country and billions around the world. What are some of your thoughts there?
It's a really important question.
Mm-hmm.
And I think my thought is we better be starting to work on that right now.
Yeah.
And we are starting to look at that, but we have to be prepared because it is going to be a combination of both government and private industry in order to, in order to do the right thing and get the vaccine where it needs to go. We all, but we can't we have to be able to walk and chew gum at the same time, right?
Yeah.
And part of what we didn't do and part of what we're doing now, even in terms of looking at a new wave, the second wave of the virus, we have to start planning for it now. And I do believe we can. It won't be perfect.
Mm-hmm.
It won't be, we're going to learn things in real time that we couldn't have thought about, but we really need to start looking at this now and preparing. And that's the only way that we're going to be able to get the vaccine to the most people and to the people that need it. And that means that, I think starting in September, we can start to develop a plan that, we need to understand how much can you how much can you produce? What is realistic? Are there going to be one vaccine or multiple vaccines? What if there's one? What if there's multiple? How do we plan for that? We need to be doing that, and we need to do it soon. We really do.
Yeah.
That's what we'll be working on. Honestly, that is really, and we've been starting to think about it now, but we have to do that.
Yeah, and we look forward to working with you on that, Senator. Just so you know, we had a call yesterday with Senator Roush. We had one the day before with Senator Feingold, and we've also we'll be having a call with Secretary Sutters on Friday morning about this very topic. So to the audience who's listening, any ideas that you have, the brainstorming and working groups are taking place right now. And I want to say again how proud I am of government in Massachusetts, the way we've dealt and responded to COVID-19. We have a lot to be proud of. And I would hate to see, because of the fact that we're one of the healthiest states in the United States of America, that vaccines manufactured in Massachusetts leave our state to go address the issue that was created by people not acting as responsible as we are in Massachusetts. So the better we work on this plan and we get ahead of it. And you're right, we have to be able to address this while we're addressing other things and walk and chew gum at the same time. So we'll continue to do that. Let's talk about a topic that you're really a champion of, and we're very grateful for. Step therapy. As you know, patients trust their healthcare providers to prescribe treatments that best fit their healthcare needs. However, insurers continue to use step therapy protocols, which require patients to try and fail on one or more medications that their insurer selects based on exclusively on cost before she or he can step up to the medication recommended for the prescriber. What are some of your thoughts, and how do we ensure that patients have access to the medications that their doctors think they need?
Well, yes, I am a huge proponent of addressing step therapy. I think it's one of the examples of where business and the business of business gets in the way of providing healthcare. And I think we have to be, I think it's really gotten to a point where it's a total imbalance, right? And we need to make sure that people, I was just on a call with Pan's Panda folks.
Yes.
you know, it's just, there's known science and there's known,
It's a horrible situation.
it's a really difficult situation. And to me, it's such an easy lift. Like, stop doing that. We have the science, stop doing it. We know how to treat people with PANS Panda. We know what the ramifications are when you don't. So why are we having this discussion? So I believe we have to stop it. I also know, Bob, that there are lots of players in this. And there are lots of players that own a little skin in the game for why we've sort of gotten to this point. And so while I want to say to insurers, stop it, it means that the PBMs have to be involved with how we do, you know, what our formularies and how they're developed. The drug manufacturers have to be involved in what their relationships are with PBMs and with the delivery system, and making sure that while everybody's making money, which I am totally for, that, you know, we're being reasonable and realistic and remembering that we're saving lives here. It's not business. So everybody's got to be part of this, and we have to hold everybody accountable at the table. But while we're doing that, I believe we really just need to stop having the consumer be the person who suffers. And so I think we need to be very clear about how insurers can use step therapy, and that we have a system that continually updates the science, right? Because we keep learning new things. We have new systems and new treatments in place, and they work. And we can't just make it. It can't be that you need a statute to get the care you need.
Yeah.
So
and that's why we've had a tremendous amount of success working with Dr. Michael Sherman at Harvard Pilgrim Healthcare as he leads the way as it relates to value-based payments, because a lot of these new therapies are breakthrough, and there is more cost associated with it, but they save money because it's a better therapy, and it keeps people out of the hospital, and it keeps them healthy. You know, if you can treat one of these Panda patients and keep them out of being in a hospital institutional setting, right, for their own safety, to keep them healthy, think of the money that treatment saves. So, you know, I thank you for that. And one of the things I also want to say to the audience is, you know, every time we work with you in your office on any of these issues, of course, there's a lot of different people involved and there's different points of view. But one thing that I will let this audience know, Senator, that I know that you always care about the patients. You always care about your constituents. You care about the patients. You care about the people that are fighting that illness. And for that, I'm very appreciative. So thank you for that. And, you know, I think that's a good lead into, you know, our next question, which talks about, it's kind of difficult for me to explain this, but I always used to say as a CF dad that, you know, disease doesn't discriminate because it can hit anybody. But COVID-19 came along, and something that it opened my eyes to is that it really opened my eyes to more so to healthcare disparities. I've always thought that there were significant disparities in clinical trials for a lot of different logistical reasons and whatnot. But when COVID-19 hit, I mean, it really put a magnifying glass on racism and healthcare disparities. And a lot of what, you know, the Senate debated a policy and racial equality bill last week. And I think it would be a great opportunity to talk about that, because when you look at where this pandemic, certain populations it hit, it does discriminate. Okay. So would you want to talk a little bit about your views on that?
it's an awfully big subject and question.
Yeah, it is. It is.
I mean, I guess in terms of healthcare, which I'll talk about, look, if we have where there's a will, there's a way, okay? And if we want to address the disparities in healthcare, we have to start looking at where our healthcare dollars go. And right now, our healthcare dollars go to places that don't necessarily deal with the preventative and the activities that will help people stay healthy and catch things early. And that is in our primary care system. And people don't have access to primary care, and therefore they don't get access to those things that keep you healthy. And I'm separating out the environment and education and housing, okay, because that is a whole other component, right, of what makes people healthy, right? But just in the healthcare system, our dollars go to specialties. Our dollars go to, in very large part to treating an illness as opposed to preventing an illness and keeping people healthy. We need to fund our community health centers. We need to fund those activities that get to people early. We need to say primary care really matters, and that primary care has to be integrated, and it's integrated with behavioral health. And I think if we start to do that, if we start to put some of our dollars, some of our focus into primary care, we are going to see those disparities go, disappear. And it's also geographical, and right? It's like harder to treat people in rural places than it is in Boston, right? It's hard to even keep it going, right? To have a business model that you can maintain those services. So we've got to focus on those pieces. And I know we've been working on some primary care legislation that shifts some of that money that we spend in our healthcare system, of which there is an enormous amount, to more primary care. And I think that's the first thing that we need to do, along with housing, education, and environment.
Sure, and I think that's pretty much how you're outlining some of the rest of your priorities for the session as well, right, or leading into 2021 as well.
Yeah, I think we do it. If we can get through this, I mean, we still have a lot of work to do to make sure that people can get through this pandemic, but we're also learning things about the system that, like telehealth and scope of practice, that we can apply and keep going, and we should keep those in place.
Yeah, that's wonderful. That's amazing. And, we're running short on time here, Senator. So I wanted to just say thank you again, see if you have any closing remarks at all. There are a couple of questions that are still in the queue there, but Susan's going to jot those down and we'll get them over to you so we can answer questions to folks in the audience. But I want to thank everyone in the audience for joining us. Senator, I know how crazy your week has been this week, and I know how crazy the last several months have been. And I want to thank you for your service. I want to thank you for all that you do for your constituents. I want to thank you for always keeping the patients in mind. Do you have any closing remarks that you want to share with the audience at all?
It was fun.
Okay, good.
And I appreciate you having me on, and I know we don't always come off on the same side, but it's great to continue the conversation, and I'm always willing to engage. So thank you so much for reaching out.
Thank you very much, Senator. So have a wonderful rest of the week. And to ladies and gentlemen, I want to thank you all for tuning in to Policymakers Live. I want to let you know that on Monday, July 20th, we will have our virtual briefing with Representative Denise Garlick, who is the Vice Chair of House Committee on Ways and Means, and also a nurse, works in the healthcare industry. And then also on Thursday, July 23rd, our Policymakers Live will be a virtual briefing with Representative Joe Wagner, who's the Assistant Majority Leader and also working on the Economic Development Strategy for the House. Again, I want to thank our sponsors for the July series, AbbVie, Sanofi Genzyme, and Takeda. That's it for today. We're going to be signing off. Everybody have a wonderful weekend. I'm excited to jump on to the next call with the Health Policy Commission. So have a great day. Take care, Senator. Thank you.
Bye. Take care.